Great to meet you.
Good to meet both of you.
Yeah, thank you so much for taking your time. I love chatting with you a month or so ago, and I'm excited
Yes.
to learn some more.
Thank you so much. Here, wait a minute. Let me just silence my phone. So
You too.
Actually, I should do the same.
Right, we're all yes, good idea. There we go.
Dr. Kimless, I was watching you on CanMed, and you are like absolute inspiration. You're an expert. Wow, and I'm actually really looking forward to learning about those things and even to ask you these things in person because we have been interviewing a lot of experts, and I've been looking forward to this one. And I know Nicole has been researching some topics to ask you. So just as we begin, I wanted to introduce myself and kind of go over the format and what we're doing and why we're trying to do that. So my name is Ivan. I'm one of the co-founders of Calm by Wellness, and we're actually based out here in Irvine, California. And the biggest thing that we're hearing from the community is that people have so many questions and there's just not enough answers. And there are answers, but then you don't know who they're coming from. So that's the other part. You can go on the internet and you can find, yeah, this solves this, but at the end of the day, people are looking for answers from trusted sources and scientists and doctors and researchers. And this is why, and this is the purpose of this interview and this Q&A session, is just to get the answers from the experts like yourself and just have a sit down and like a round table and just have a nice chat. And Nicole is our senior editor at Calm by Wellness, and I know you've been chatting with her through email, but she's an expert in this field as well, and she writes a lot on CBD and cannabis. So yeah, just a little bit about us, and we'd like to hear, if you can do a quick introduction, and then we'll dive right into it.
okay, great. So hi, my name is Deb Kimless. I am a board certified anesthesiologist, pain medicine specialist, and most recently boarded in lifestyle medicine, which is a new medical specialty that actually looks at what we do in our lives holistically as the foundation for good health. So go figure, that matters, right? In addition, I've spent since 2013 going around the world and studying and then helping guide patients as well as conducting clinical trials on the use of medical cannabis for the treatment of different types of medical conditions.
Wow. You're the real deal. Thank you so much for taking the time to chat with us.
I'm also the chief medical officer for Pure Green, a medical cannabis producer and formulation company for which we are actually meeting with the FDA.
Wow.
And we just submitted an application for IRB approval for our first clinical trial, which at the end of that, giving birth was a lot easier, just saying. Um, I'm the medical director for a cultivation ForwardGro in Maryland, as well as a medical director for a dispensary out in North Dakota.
That is wonderful. You are helping people all over in a lot of different facets. Let's see. So, would you be able to tell us a little bit about the clinical trials that you've worked on?
So, most of my clinical trials were based on looking at a formulation, a special formulation, understanding the synergistic effects of cannabis and terpenes, and applying that in a consistent dosing form. So it's a rapidly dissolving sublingual tablet. And I initially formulated this thinking it wasn't going to work. And I trialed it on 16 people. It is thus expanded to over 50 for the reduction of pain. And it was an undifferentiated sort of chronic pain patient paradigm. We're now going for IRB approval for that as well. And we changed the iteration a little bit. So the initial formulation had CBD as a 5 milligram. Now we have a 20 milligram just because in certain pain settings, 5 was just not enough. And I wanted to be able to go toe to toe against over the counter medicines, since I'm looking at the CBD landscape now, and it looks like that may start trending towards a potential over the counter option. And I want patients to have a safe and effective option, at least to start, for their pain relief. There's two others that we're running. We're running a Pure Femme trial, which is for menstrual pain and menstrual related symptoms. I'm super proud of that because if you look at most studies, whether it's traditional pharma or anything else, women are excluded. And this is a woman only, obviously, because we're the only ones that menstruate and suffer with all those conditions. And so I'm really excited about that. We're looking at, again, a special formulation, a sublingual tablet, CBD plus a little bit of THC, fatty acid amide, and some terpenes that I've curated. And we have actually done a proof of concept and have done really well with it. And now we're going for IRB approval and looking actually for people, preferably in the state of Michigan, women in the state of Michigan who want to participate.
That's amazing. And in the formulation of roughly what is the percentage or ratio of CBD to THC?
So the ratio is a 3-to-1 ratio, CBD to THC, but it's 30 milligrams of CBD, 10 milligrams of THC, palmitoyl ethanolamide, which is a fatty acid amide that our bodies make, plants make, and has been known since the 1950s as being a reasonable pain reliever in and of itself, plus 5 curated terpenes that I know that work on either CB2 receptor or in other non-cannabinoid receptors that allow for relaxation, anxiolytic, muscle relaxation as well, which is all important. As we know, going through menstrual cycle, we experience a whole lot of stuff, and I'd like to address as much of it as possible.
Interesting. Actually, so just to jump off that point, are these terpenes from the cannabis plant or just from outside of the cannabis plant?
So these terpenes happen to be from the cannabis plant, okay. Although there's a big conversation about whether or not it makes sense that these terpenes are extracted specifically from the cannabis plant versus other plants that also make terpenes. I mean, cannabis, it's, you know, it doesn't have the sole option on terpenes. They're everywhere. And so there's nothing really specific to the cannabis plant as long as your stereochemistry is the same. And so that's, you know, really important to understand. And thankfully at Pure Green, we have scientists that really understand that. So if we do decide to change from cannabinoid or cannabis derived terpenes to others, they'll know what to look for.
Thank you for clarifying. I was asking because it is a commonly brought up topic where a lot of these terpene formulations and there's this debate like, hey, no, it must all come from the cannabis plant. But then there's this wide variety of terpenes that come from just outside of the cannabis plant. So yeah, that's the reason why I wanted to talk about that.
But what I envision or what I look at, and I feel incredibly grateful having my hands in different touch points within the industry, is that I am able to really look at laboratory results. In fact, I test them myself, but I'm also able to look at independent testing lab results to see really how much terpene do you need, right? Like, people are inhaling straight up terpenes. That's concerning to me because I worry about, you know, an anaphylactic problem or a bronchospastic problem. When you look at the terpenes in cannabis, total terpenes, and there's 50 plus that are assayed, about 2 to 3% total. Not a lot.
That actually brings me just something I've thought about